Everyone. So hold on, I just want to make sure I'm recording. I am. All right, so we're gonna go over quite a lot of information. I'll stop after like the first little part so we can ask some questions, and then we'll finish the last part, and then we'll do more questions at the end if you have any. Um, so the first thing to kind of go over is we do have a policy that states it's called perioperative staff responsibilities. It is quite lengthy. I've worked a lot of it into this presentation, but I encourage everybody to check it out online. I believe we did some revisions not too long ago, so there's a newer version coming up. But the only thing really changing is the old version has that orange paper sharp thing on it, and we're not doing that anymore. So that's really the biggest change there. So let's just go over these definitions. The RN circulator is the surgical team member who is responsible for coordinating and controlling the multidisciplinary activities required to provide a safe environment for patients undergoing surgical intervention. The RN circulator is also the patient advocate. It's a mouthful. The scrub personnel is the surgical team member who is responsible for controlling and maintaining a sterile field with instrumentation, supplies, and equipment required during the surgical intervention. Now that's a lot. So what does that actually mean? Like, what are we asking each of you to do on a daily basis when you go into the rooms? So the first phase we're going to talk about is the preoperative phase. So we'll go over what the circulators do, and then we'll go over what the scrub personnel should be doing. So if you are assigned to a room when you come in the morning for your shift or in the evening for your shift, you will check the OR schedule to determine the patient's name, surgeon, anesthesiologist, all of those basic information, and then communicate with your scrub what the surgical procedure is on the consent. We all know sometimes what's listed on the surgical schedule isn't necessarily what we find out when we check the patient in. So it is the RN circulator's responsibility to be communicating with their scrub. Inspect the OR room, make sure it is clean, safe, and operational. Check that you have all necessary instrumentation, supplies, and equipment are in the room. This one is important to me. We're to assist our scrub person in preparing for the surgical case according to the established procedure and the preference card, including helping to open the instruments. Sorry, talking too much already. So please help your scrub open if you have the time to do it. Just because you're done checking in your patient and gathering what you need for the room doesn't mean that we don't also work as a team to help each other out. This one's also important. Please communicate with the scrub that you're going to get the patient. I think it's important for the RN and the scrub to work together. The RNs are going to complete the preoperative assessment and same-day surgery or up in the unit before bringing the patient to the OR. If the patient's receiving a block, and this is really important, and this is relatively new, if your patient is going to be receiving a block, and you'll know that because we note it on the whiteboard at the front desk, and the charge should be telling you, we want that check-in to be done by 7 a.m. And that is just so we make sure that the patient starts their block in enough time for you to go in on time. I then complete pre-op huddle at 7:20, and we've gone over pre-op huddle, so everybody knows how to do that. Any possible delays, please communicate them right away to your OR supervisor. What I see a lot is we wait until the last minute to be like, oh, by the way, we don't have this, and this equipment in the room. Sometimes that's something that we can help you with, or if it's just you need an extra set of hands to help the scrub open, communicate with the charge. That's what we're here for, is to help everybody out in the mornings. You're not alone. We have a lot of resources now, so let's use them. Okay, so that's the RN for the scrub. Assist the circulating RN in checking the case card and surgeon's preference card. Ensure that all required supplies, equipment are available and functioning. You do share the responsibility with the circulating RN to prepare the OR for the day, meaning wiping your horizontal surfaces, opening supplies, checking equipment prior to scrubbing in. Prepare your back table as necessary, verify complete instrument trays. Indicators, please, please, please check your indicators. I know recently we've had a couple of amazing saves by our staff. Anita had one. I'm sorry, I'm blanking on the other person who had one, but you all are very diligent about checking your indicators. So please continue to do that, because as much as we take it for granted, sometimes that indicator hasn't changed, and it's important for us to check that. Position sterile tables for convenience and efficiency while observing principles aseptic technique. Communicate with the RN circulator any concerns or possible delay in care. And same thing, any delays, any problems you're having in the morning, please don't wait on it or take it on completely yourself. Let us help you if it's something that we can help you with, or if it's just an extra body. So that's the pre-op phase. Questions about pre-op phase before we move to
Can you
intra-op?
remind people to check trays prior to putting them on tables?
Yeah.
Because everybody's always in a rush.
Yes. Yeah, so that's part of our checks, right? And it does save us. I think we've all been in the circumstance where you don't check, you put it on the table, and then you check when it's on the table, and it, of course, it hasn't turned, or there's an issue, and now all of a sudden you have to tear down your whole back table. So yes, we are in a rush. We want us to go in on time. However, we have more resources than we've ever had before. So let us help you if you're running behind. However, that doesn't negate everybody's responsibility. If you're in a room, that's your room, and you need to have some ownership over your room. Okay, are we ready for intra-op? Yay. Okay. This is a lot of stuff. Okay, the RN circulator will deliver sterile supplies, solutions, and meds as required or requested. This next bullet is really just about the OR traffic. So we obviously want to limit traffic in and out. For our circulators, that also means you limiting your traffic in and out. You're there to circulate. So if you need to go get a supply, by all means, go get your supply. If you need an equipment, go get your equipment. If you want to come to the front desk to check your call schedule, maybe that's something that can wait until you're not taking care of a patient. We really want to try to minimize the amount of time you're spending out of the room. 100%, if it's not for patient care, for that patient that you're taking care of, you really shouldn't be leaving the room. Performing all counts. We've gone over the count policy, but obviously it's your responsibility to perform the counts. Collecting the specimens, appropriate container, label, and document. Documenting accurately in the EMR. A lot of you are getting pushbacks right now for charts that aren't completed. In this next year, we're really going to be focusing on making sure all the charts are finalized and completed correctly in like an appropriate amount of time, meaning that day. You really should not be leaving your shift if your patient chart has not been finalized. Blood and blood products, it's your responsibility to verify the units and to do the paperwork as appropriate at the front desk. Implants, this is a big one. We had this happen not too long ago. Make sure that you're showing whatever implant you're going to open, verify that with the surgeon prior to opening it to the sterile field. And then reconciling the implant record with the sales invoice for the rep if present. Slide 2, dispense the medication using sterile technique with the scrub tech. Remember, I know we all get used to working with each other, and there's certain scrubs that we're with every day, but it's still important to verify whatever it is you're dispensing on the sterile field. Those shortcuts can really harm a patient. So it's important that if you're opening a medication, go through the process of reading the label, showing your scrub tech, and then labeling appropriately. The RN will initiate the timeout and follow our timeout protocol. Monitor the sterile field, assist with surgical dressings. This next one is very important. Maintain situational awareness, meaning when you're in the procedure as the circulator, I'm well aware that there's busier times and there's slower times, especially if you're in a long case. But I want us to all remember that we're taking care of a patient. And if that was my mom or my dad, I would want everybody to be present and fully aware of what's happening in the OR, anticipating needs, not looking on Pinterest for whatever birthday party they're gonna plan next. The phones are hard, I get it, but I really need everybody to be present with the patients and put it in the framework that if that was your family member, you would want their circulator to be fully present in their procedure. So that's RN. For scrubs, intra-op, perform the counts according to policy, assist in gowning and gloving surgical team, anticipate needs of surgeon. I'm kind of going to go over these fast because there's a lot. Ensure instrumentations are free of blood and debris during the surgical procedure. Label all solutions and medications, monitor and control sponges and needles. Big one, we've had a lot of miscounts, and a lot of them have to do, it's not that we're actually missing something, it's that we've missed something as far as we gave a needle, we didn't get the needle back, and now we don't know where the needle is. So as the scrub in the room, it really is your responsibility that everything you give, everything you pass is being passed back to you. And if it's not, then we can reconcile it right there instead of waiting till the end when our counts are messed up. Make sure you're identifying specimens with surgeons, accurate list of implants and explants used during the case. For this, I think more of about our spine cases when we're putting in a lot of screws and crosslinks and all of that stuff. We need to make sure we're monitoring what's actually going in the patient. Obviously, monitoring the sterile field to maintain sterility. Initiate and actively perform all counts. While unscrubbed, please assist with patient care activities. I know that you all work very hard and that being scrubbed in all day can be very taxing and waning and you want to sit down for a minute. I understand that. However, it is not appropriate to sit down and then be in a corner on your phone while your patient is being brought into the OR, transferred over to the bed, or waking up, any of those things. Like, we're here to do a job and to take care of patients. So my ask is that we all work together to do that. Okay, questions about intra-op phase before we go to post-op or comments? You guys can speak up. I'm just getting text messages now instead of questions. Okay, AirPods, such a good point. Please, AirPods are not appropriate to have in your ears while you're taking care of a patient. That should go without saying, any AirPods or any headphones. It's also not appropriate to be scrubbed in with AirPods or headphones on. Even if your patient's not in the room yet and you're just setting up, you shouldn't have AirPods or headphones on. It's a potential for a contamination. It could fall out of your ears and onto the sterile field. So please, none of that. Let's move on. Anything else for intra-op before we go post-op? And again, I'm going fast because a lot of you already know this, and we're going to really focus on the resource staff stuff. Okay, post-op. So the RN circulator will remain at the patient's bedside, assist anesthesiologist as required, discharge the patient from the OR to the PACU or to the ICU. What do we make sure? Okay. All right. We make sure that every patient has an ID band on. Please, 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 this is part of like our little checklist before you leave the room. ID band needs to be on the patient. You're going to give your necessarily report to either the PACU RN or to the ICU. You're going to complete documentation. Complete. Please do not go on to your next case if you haven't finished your charting for the case that you just finished. It just sets up a bad habit. So just complete what you've done and move on. Take your specimens to pathology, complete the pathology logbook. Blood coolers, let's make sure those get out of the room. We've done really well recently and not leaving any blood in the room. So let's keep that up. If you do not have a case to follow, it is your responsibility. It is in the policy for the RN circulator as well as the scrub, all extra equipment. So unused supplies, unused instruments, everything that you've brought into that room for the day needs to go be put away. We've all been there in the morning where we've come in and it looks like they didn't take anything out of the room. the night before when they finish. So please do that same courtesy for your coworkers and clean up after you're done if you don't have a case to follow. If you have something that's malfunctioning, please make sure we take it out of circulation. If you're too busy to do it during the case, you can do it after, or you can call the OR supervisor and we'll get someone to come take that piece of equipment out and fill out the biomed form. The scrubs. After the case, right, you're going to remove all instruments, sponges, sharps from patient drapes. Please look around on your drapes. Make sure that you are not throwing something away that is not disposable, like the CUSA, or what else do we like to throw away? Harmonic cords. Check all of that. Make sure we're not throwing things away. Take the drapes off. Remove linen disposables from back table. Let's see. Separate all sharps, needles, and blades. We have had this month at least 2 sharps go down to decontam at the end of cases. So it is your responsibility to make sure that you're isolating your sharps and you're disposing of them in the correct manner. Aspirating all the fluids from your bucket into the suction canister, removing the dirty instruments from the room, transporting them to decontam, spraying your instruments. Please don't forget to spray. I'm just making sure I'm getting everything. Assist in removing equipment not needed, inspect the room, and then proceed for prep for the next case if you have one. If you don't, just like what I said for the RNs, make sure you're putting away all unused supplies. Please put them away. Unused instruments, those go to the clean elevator room, and then you scan them using the SensaTrack. That's our current process for unused instrument trays. Okay, that was a lot. What questions do we have? Sophia, what can I answer for you?
So, question. When a person gives a break, the person that are giving breaks, is it only that they do a break, or do they help with opening the trays and helping them with whatever they need?
Sophia, that is a wonderful question that leads us to our next topic, resource staff responsibilities.
Ay, Dios mío.
I know. So we're going to go, but that was beautiful, Sophia. We're going to go through all of that right now. So before I move on, anything about your role and responsibility when you are the RN or the scrub assigned into a room?
Okay. Taylor, not a question, but just another reminder for the scrubs. If the surgeon asks you, hey, you know, I need you to move to the other side because we need to see the screen or whatnot, right? Like if they need to have their assistant be in a certain location on the field, please follow the surgeon. I've heard a couple of complaints from surgeons that they had to mediate between a scrub and the fellow because the scrub said, well, this is where I always stand. I mean, we do have to, you know, the surgeon has the ultimate responsibility to provide care to that patient. And certainly if it is a patient safety concern that you're saying, no, I can't move there because, I don't know, the patient's going to fall, whatever it is, then by all means, that's a reasonable thing to say, no, I can't do that. However, if the response to the surgeon is, well, I've always done it this way, or, well, the other surgeon does it this way, it doesn't really give a sense of, you know, respect to the surgeon. So just be mindful if you're scrub, you know, make sure you're following through with the surgeon requests. So that's it.
I have a comment. Yeah, so it's actually between intra-op and post-op. So when we're doing counts like closing and final counts, I have encountered a couple of scrubs wherein if we count the knife handles and or the blades, just so to address that concern that we have with sharps being brought down to decontam, I actually tell my scrub that's like, oh, okay, you mind taking off those blades off the knife handles? And, you know, I have been met with a little bit of sarcasm before, and I know that it's not needed anymore, particularly if like the drain has been placed already. So just, a word out there, it's not really useful to be sarcastic when a safety issue is being addressed, just as a preventive measure, and it's actually like assisting the scrub per se in the process of preventing sharps being brought down to the decon plant. So just a word out there, it's for patient safety. It's nothing about you per se as a scrub. It's just a safety issue being addressed that can prevent injury to other people. That's all.
So that's a good point. I think, and I know this is a lot coming from me, sarcasm while we're counting is probably not necessary, especially since it is such a serious, it's a serious time. And we know that this is our area of improvement. So during counting, we should all maintain our professionalism and stay focused on the task at hand. I hear you, John, with the knife handles, like unloading your blade. However, there are some procedures, right, where the scrubs like to still have a like one blade loaded at least until the patient leaves the room. I know that's kind of more of an old school teaching. I know I was taught that way. So that's something for discussion, but I definitely appreciate us all being aware of our sharps and taking our counting process seriously. Let's go to resource staff responsibilities. Okay, so we're going to do the same model where we'll talk about what the RN resource is responsible for and what the scrub resource is responsible for. So RN resource, when you come in for the day, if you notice that you're a resource nurse instead of in a room, you need to check your room assignments on the board. This is important. Please don't come in and then just wander around the OR for a good 45 minutes and then come upstairs and then see what your assignment is. You're here to work, so you're clocked in at this time. So it is your responsibility to come up, check your assignment. If the assignments aren't up yet, the OR supervisor will task you for doing something. I know a lot of times, especially on Fridays, Ariel will say, okay, go help whatever room open or give you an assignment. So don't just assume if you don't see your name that you don't have an assignment. We are going to start a checklist. I'll go over that at the end, but this is going to be mandatory. So when you are a resource staff, you will be picking up this checklist when you come. So in the morning, we're going to round on our assigned rooms, asking the RN circulator what assistance they need. Assistance can be patient check-in, medication retrieval, equipment retrieval, assistance in opening the sterile field. I know sometimes you have 2 rooms, we're getting away from the 3 rooms, but sometimes you have 3. I'm not saying that for every case you have to do everything. The RN nurse assigned in the room is not supposed to just pawn off all the responsibilities on you. However, you are there to help. The scrub for your first case, same thing. You need to check your assignments on the board. If you don't see your name, you need to talk to the OR supervisor. You will also have a checklist for the day that you need to pick up. You're going to round on your assigned rooms and ask the scrub personnel what assistance they need. Same thing, equipment retrieval if they need an instrument or a supply, and then assistance in opening the sterile field. So that is in the morning stuff before we start even doing breaks. Now and we're going to do break stuff at the end. We're just talking about what we want to do in the morning and what we're going to do for to follow cases. So for to follow cases for the RN, you are to check in the to follow patient. Now, are there some nurses who would rather check in their own patient? Absolutely. The solution to that is you then need to relieve the nurse in the room so she can go check in her to follow patient. But the expectation is that as the resource RN, you are checking in that to follow patient. And you're going to assist with OR turnover. That means if they need you to grab a med, if they need you to get equipment, assistance at opening sterile field. This one's important. During the first case, you should be asking your nurse in the room, hey, is there any positioning aids you might need that we could help start gathering with the orderlies? So those are the type of things we're looking for assistance for the turnovers. And scrub techs, you're going to be obtaining the next case cart, checking for missing items. If the yellow sheet's still on the front and you're missing certain things, we need to just let CSPD know so they can bring that up. And then assisting with the turnover. So gathering equipment, instrument supply retrieval, and assistance in opening the sterile field. So we're going to go over breaks, but these are the things that we are saying is part of your responsibility when you're a resource staff. Are there questions about those responsibilities or comments before we talk about breaks? Anyone? No? Okay. All right. Breaks. So I kind of outlined this out because we do have a lot of newer people.
Excuse me, Taylor. I have a
Yes.
question.
Yeah, go for it.
What about when like our assignment gets changed? Like what if you're helping a room and you're midway through all these tasks that we have on this list and then our assignment gets changed?
Yeah. So
work?
I'm working with the OR supervisors because I know that's disruptive, right? You come in, you see that you're resourcing 2 rooms, you're starting your flow and you've talked to everybody, you know what you're doing for the day. And then us charge nurses mess with you. I can tell you it is nothing that we're doing on purpose. Most of the times there's some sort of surprise. We either have an add-on case that needs to go now, so we need to pull the appropriate staff. Someone's not here, all of those things. I'm working with the charge nurses to try to minimize the amount of times we have to move you around. Unfortunately, it's unavoidable at some times. So it's all within reason. These are the guidelines, and this is what we want to see our resource staff doing. However, if you've been changed into 3 different rooms throughout the day, then obviously you're not going to be able to complete all of that. And that's just stuff that we need to be in communication with. Just as much as we're laying this out because we know that we can improve as resource staff, I also know that like we as leadership can improve in how we're assigning the breaks and everything. So that's why we're going over this. And that's why too, we're going to be doing this actual, and I'll show you the form at the end of the day, because your feedback is necessary too. Like we need to know what's working and not working so we can kind of fine tune all of this.
Taylor, which form
Yes.
is that?
What?
Which form is that?
I'm going to show you guys once we're done with the break part.
Yeah, because you know, since we're talked about turnovers too earlier, you mentioned at the start of this presentation about resource both for circulator and RN, for circulator and scrub. Yeah, because a lot. I've had a very bad experience not too long ago. A delay of an hour and almost an hour and a half because our case card could not be found, and then it was found. It was in a corner.
Yeah,
there
so
was
that's
no instruments picked and all that. So, and particularly, it was a case that involved a resource. Both resource RN and scrub were both coordinators as well. So that's, you know, I know that this is more driven towards newer staff, but there is still staff that has been around here for much longer than I have, and
So
that's
if I
the
can
thing that really bothers me.
interrupt for a second, John. So just to clarify, this in-service is not just focused to the new staff, right? I think we've done a lot of work, so it's just time to reset and establish expectations for everyone. And I want Taylor to finish it because we also still need to do the IRB hands-on in service, and that is because I think there's some cases that happen on the weekend. There's no AB techs here, and some of the staff aren't sure, okay, how are we processing, or not processing, but how do we handle the scope over a weekend so that it's not left sitting in a room, you know, used. So if we could just kind of have Taylor finish it, and then we'll leave the questions in the end. We're actually
a little
5 minutes over, so
I'm going to go faster.
Okay, Jen, I'm sorry about that.
It's okay. And we can keep talking about this, right? So AM shift breaks. So quickly, these are, and I'll post this, everybody, but this is the timing we're looking for. Please remember, as far as the order, 8-hour and 10-hour employees are in the same bank, meaning that they need to go to lunch before that 11:30 mark. I know I've seen a lot of 10-hour employees actually send back their relief person saying, oh, it's too early for me to go. Like, meal breaks start at 10 a.m. And especially on our busier days, we need everybody to start going to break when they're being offered. And if you're refusing, we are asking that the resource person escalates to the OR supervisor so we can go ahead and address that. So look at I'll send this out too so you guys can look at the timing for breaks. Mid-shift breaks, I'm not going to go into this because this is more for our mid-shift and PM shift colleagues. And again, I'll send this out so everybody can look at it. Let's go straight to this form that I was talking about. So when you come in the morning, when you are a resource staff, you will be picking up this form. It really is just like a checklist as far as the stuff I talked about that is your responsibilities. And then we really want to capture the times that you're giving your breaks. And the reason being is we want to see, how does this all work out? Is there enough time for you to get everything done? Are people sending you saying, I'm not ready to go to break now, and sending you away? And that's causing you to be an hour behind when it comes to giving your other breaks. And I know those are the things that are happening. You can't see it here, but there's also a portion on the bottom for any feedback. This is where you can let us know, like, look, my assignment changed 18 times today. It's disruptive. Like, this is why, this, and this. And that will help us grow too as leadership as we're making these assignments. Questions. I know I kind of breezed through this last part, but I'll send this out as well. And then we're recording, so I can also post that recording. Any questions as we kind of finish up? This is going to be a work in progress. This will start on Monday. So on Monday, when you come to work, if you are assigned into the hallway, and I'll be here on Monday so I can help with this process, you're going to be picking up one of these forms, and it is mandatory for you to fill it out and then drop it back off in the afternoon before you leave for your shift.
Taylor, I have a question. This is Maria.
Hi, Maria.
Hi, good morning. The question is, when I come in the morning and I look at the board for breaks and stuff, because I don't see my name assigned to a room, it takes the charge person a long time to fill it out. And I'm just kind of waiting at the front desk until they assign so I can go and help my rooms, whoever they're going to put me in. But it takes them a long time. And it's a new thing they're starting to do, and I really don't like it because I'm still waiting for, do I relieve the heart room? Do I leave, what room am I going to be in so I can go help them? And another issue I also had is the RNs should not be utilized for bringing equipment. That should be assigned to the orderlies and told ahead of time so they can prepare all that stuff outside the room. I don't mind it if it's an emergency situation where you need it right now, then of course I don't mind. But all that has to be planned with the orderlies in mind so that we can do RN stuff, checking the patient and stuff.
Yeah, Maria, I agree with you. I'm sorry. What I meant by that is, if you need a piece of equipment and that's identified, calling the orderly and letting them know so we can get it ahead of time instead of like rushing around for it.
And if I could address another issue, whenever I leave the room in the heart room, it's usually to get blood or retrieve the paper for getting blood to give to the front desk. I look in the hallway for anybody so I can give it to them so they can address it, but knowing that it has to be an RN that says what room number, what blood, and that kind of stuff.
Yeah, and that's an appropriate time to leave the room, right? Like, what I'm talking about is when I've had people leave rooms to come talk to me about vacation requests and they're in the room with a patient. So those types of things, like doing patient care items, I understand completely you having to leave the room. And then I'm going to take, Maria, I'll take back what you're saying, because that's a good point about the OR supervisors. And like I said, this is a process that we can work on with the supervisors as well. Anything else, everybody?
Got another questions in regards to go backs. Is it only assigned to one person or is everybody taking turns?
So that's a good question. Right now, I mean, if you're free in the hall and you've done these assignments, absolutely please help us with go backs. Right now, the supervisors are more so assigning people to do them because it seems like we get more done that way, to tell you the truth. But that's a good comment, Sophia. So we'll take that back so we can kind of fine tune this whole process. So we are out of time. Just to remind everybody, we're not doing the EGD in service today, just that was rescheduled. So today is just going to be IRB and it will be out by the hallway. And then this process will start on Monday, but I'll be up at the front so I can kind of help us get started in the morning. Is there anything else that I can answer for anybody right now before we kind of sign off? Okay. Thank you guys all for listening. I know it was a lot of content. I'll send everything out as well, and feel free to catch me for questions or concerns or comments or suggestions. And that's it. Everybody have a good day and check out the IRB at the front. Jen, do you have anything else?
No, thank you. I guess the only one thing is, like, you know, we'll start this on Monday. If you guys find that, hey, we need to tweak something, let us know and we'll change it, right? We've never had this kind of checklist before for the resource staff. So, you know, any input, feedback, we're happy to make changes.
Yeah, definitely. Okay, thank you, everyone.
Thank you.
Have a good day.